Let's go, ReMar. Let's go. Yes. Yes. It's Winning Wednesday. You're here to be a USRN. I'm a USRN. I'm cheering for you all the way. Your dream is very possible. It's very possible to pass the NCLEX. Is it a big test? Yes, absolutely. But when you got Winning Wednesday, when you have an episode like we're going to do today, and we're talking about anorexia nervosa. Huge, 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 huge. Gotta know it, gotta know it. So we're gonna get into that on today. I'm really excited about it. So make sure that you have out your quick facts for NCLEX. You can also find this topic is so important. We learn about it in nursing school as well. So quick facts for nursing school as well. We're going to go over both of those tonight. I love Winning Wednesdays because we can just really dive into breaking up the week. If you haven't been studying consistently, then guess what? You're here with Professor Regina, #1 NCLEX instructor on the planet. Right now, I happen to be in the United States of America. But tomorrow, you never know. You never know. So we're going to get into it. Also, I want to tell you that behind me are the other very important topics that you need to know if you're going to clear the NCLEX. So you definitely need to know about legal issues. You need to know about expected changes in aging. And so what we do here with the Quick Facts book is we just position your mind for how you should be critically thinking, okay, about these issues. The subjects are very simple. When you think about developmental milestones, very simple subject. However, NCLEX likes to take the simple concepts and they like to mix them up and scramble them around and throw them back at you in critical thinking scenarios. So I highly recommend right now that you take advantage of a complete content review plus money back guarantee for anyone who does the V2 program. This is really cool because I'm very confident that for most of you, it's not a matter of can you do it? It's just a matter of how you do it. It's a matter of how you do it. And when you have structure, when you have consistency in your studying, then you absolutely, as a ReMar nurse, should be able to pass NCLEX or get your money back. That's just it. It's a simple promise. And so I'm confident that you can do it. But you got to do the work first. So get out your books and let me know where you're from. Let me know where you're from. I am, somebody asked me today where I was going to be. They wanted me to come back to, they actually wanted me to come back to Africa. They said, it's time, you need to come back there. And so I'm planning my schedule almost for next year in terms of traveling. And I'm thinking about where do I need to be? Because one thing I do, I love studying with you in person. I love meeting your faces and I love being in your environments, in your world. So let me know where you're from in the comments and get out your quick facts. We are rolling to anorexia nervosa, which in my quick facts is page number 8. So we'll be working on page number 8 from Quick Facts for NCLEX. If you are studying with me from Quick Facts from nursing school, it's cool too. You're going to take notes and you're going to be on page number 9 going into page number 10. Both are good. Both are good. For NCLEX though, what I want us to remember is that let me set expectations for you and for me so nobody is confused about what this is. I'm not going to spoon feed you the basics. Okay. When we talk about an NCLEX review, this is for a nursing student who is familiar with common terms, definitions, things like that. So I am going to sharpen your critical thinking when it comes to anorexia nervosa because I know you understand the idea of an eating disorder. But when you look at quick facts, when you read the information that's in here, it's like, boom, it really draws you to, my goal when I wrote this was for you to see that truly the focus is on the recovery. NCLEX likes to ask you about how do we help this person after they've been identified as having anorexia nervosa. And so that's what I want you to think about. So, the first sentence that I have here is the primary symptom of the illness is what? Put it in the comments. Put it in the comments. The primary symptom of this illness, very important. Um, Even looking at the words here, we're talking about a symptom, okay? Answer is starvation. Starvation is a medical emergency. When someone is starving, this reflects so many things are happening inside of the body internally because that's not a natural state for the person to be in. But what I want to focus on just in this first sentence is that this is not the cause of anorexia nervosa. What is the cause of anorexia nervosa? What kind of issue really is this? Very important point, because if we feel like we just have it all figured out, right, without really taking time to understand the pathophysiology of this, then we'll fall into the traps that a lesser nursing student would find. But not you, not you, not you, not you. You're going to know it. So this is actually a very much a psychiatric disorder. And so one of the symptoms of it is that the patient has an extreme restriction to calories. That's the starvation part of it. Now, the next sentence says, what is the mental perception of the body? Being that this is a psychiatric disorder, we know that the person has they have, how do I say it? They're not in reality. And so what NCLEX likes to do is they want to test how you respond to someone with anorexia nervosa who has an altered sense of reality. I want to ask this question. When we see a person with anorexia nervosa, we tend to say things that are not therapeutic, even though they can be very helpful. One of the things that I noticed over the years that NCLEX will say is it appropriate for the nurse to tell the patient, you don't look fat? I don't think that you are fat. Okay. Is this a good thing or a bad thing? Should we say this to the patient? You don't look fat. Now, is that the reality? It very well could be. But the thing about anorexia nervosa is that there's so much bias with this disease. Very, very biased. Very, very biased. So and I see your answers, the nurse should never say this. Actually, the nurse should not make any comments about the patient's body at all, which may be really mind-blowing to you, because naturally you would think, if you reassure the patient in this way, you don't look fat. No, you're not big. I don't see you being chubby, right? It's kind of like talking to somebody with OCD, or obsessive compulsive disorder, and you tell them, you don't have to wash your hands. Your hands are clean already. What's the reason that you should not do that? What does that put the attention on? If somebody with anorexia nervosa comes in and they're 88 pounds and the nurse says, honey, you're not fat. You're not fat, right? What does that put the attention on in the patient's mind? It puts the attention on their external image. It makes them focus on what? It makes them think about their own body, right? With this type of mental illness, if somebody says you're not fat, then the person is going to what? They're going to question, well, why would she say that? Is she judging my body? She doesn't think I'm fat. What does she think I am? Right? So in our conversations with people with anorexia nervosa, it's never about the physical. It's always about the what? The health, the nutrition, the hydration, right? It's always about the inside because they do enough focusing on the outside. And I see that very often in NCLEX when it comes to this type of eating disorder, making sure that you don't focus on the patient's appearance, focus on their health, not their looks. Do we have that? Okay, that's the point I wanted to make. Let's go to the next question here. Question number 3 says, at what age does this occur? At what age does this occur? Research shows that for the majority of patients with anorexia nervosa, this happens during the adolescent or the teenage years. Adolescence or the teenage years. Now, um, this is where we can experience some bias with anorexia nervosa. And I know that this is very important for next gen NCLEX because when we think about anorexia nervosa, we tend to have a stereotype in our minds about who gets anorexia nervosa, don't we? We tend to think that this is a young white girl's disease. That's what we think. Like in your mind with eating disorders, even if you ever watched a movie, like there we have this thing in America called it's a TV channel, it's called Lifetime. Lifetime. Am I dating myself? Who knows Lifetime? So there used to be these Lifetime movies about teenage girls growing up with eating disorders or things like that. They're always young white girls. That's what they are. However, research shows that blacks, Hispanics, Asians, Native Americans are just as likely to have an eating disorder. However, they are less likely to be screened for it. They're less likely to be screened for it. Even honestly, Black people are probably more likely statistically to have eating disorders, but almost are always never diagnosed. So I want us to be able to expand our concept of who deserves to be screened for nutritional deficits. Actually, anorexia nervosa, 1 in 4 people with anorexia nervosa are males. Actually, yes, males also tend to focus on, especially during the teenage years, they focus on what? Their muscles, their lean muscle mass, right? And so a lot of athletes struggle with anorexia nervosa. Who else? There's other populations, a lot of dancers, people that do ballet or competitive dance, they will do extreme starvation. Who else? Alternative, like people who are LGBTQ, they struggle with eating disorders because what type of illness is this? And so this is a mental illness, and it's really not about the food. It's about having control. It's about having control. And so when people are in situations where they don't feel like they have control, they focus on what they can do. And the easiest thing is, I just won't eat. I know I can control that. I can absolutely control what I put in my body. So here, I say here, these are perfectionists, overachievers with low self-esteem, with low self-esteem. So yes, um, even older people, right? Even older adults who, have you ever heard of a situation where an older middle-aged person loses a spouse and they refuse to eat? They're grieving so much. You know somebody who has so much grief that they just won't eat. And it is because they don't feel like they have control of their environment anymore. They lost their husband, they lost their wife, they lost their mother. And so they just shut down and they stop eating. These are the people who can struggle with anorexia nervosa. Anorexia nervosa. All right. The next point here says, what is a major? So the question before was, what is the usual personality type? Perfectionist or overachiever with low self-esteem. What is the major cardiac complication of anorexia nervosa? And then I have here cardiac arrhythmias. What causes the cardiac arrhythmias in anorexia nervosa? What is going to cause them? That potassium. It's the electrolytes. So yes, potassium. What else we have? Magnesium. Now, let me ask you this. It's very important for us to get electrolytes, right? Does the body make electrolytes? Can your body make its own electrolytes? Like, can your body make a little bit of the electrolytes? What did you say? If somebody asked you that, would you say yes or no? How much do you know about electrolytes? Right? So, if you were asked that, you would say no. You would say no, 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 no. No, the body cannot make electrolytes. You always have to get electrolytes from outside of the body. Okay. Your body can make certain things, like your body can make insulin, your body can make cholesterol. You don't need to eat cholesterol in your food. Your body can make it. But potassium, magnesium, calcium, you need to get that from food or drinks, right? And so if your body is not getting that from food, drinks, supplements, then you will begin to lose it very quickly. You'll begin to lose it very quickly. So cardiac arrhythmias are an issue here because of loss of those electrolytes that are replenished through food. Number question, I mean, not the next question. Next question is, what is a major gynecological complication of anorexia? This point right here has to be understood because when you have an adult female, okay, when you have an adult female who no longer is menstruating, what does that mean? Is that just like, oh, no longer a period? Patient just is what? When you have an adult female who no longer menstruates, you know that that woman is in organ failure. You know that that woman is in absolute survival mode because a healthy adult woman has a monthly menstruation cycle. So if that goes away, then that means the body is actually shutting off things that are not related to survival. And so reproduction is one of the first things to go, right? Because your body is focusing on what? If your body has to make decisions about what stays and what goes, what stays? Your brain, your heart, right? So those systems stay, your lungs. But your reproductive system, get rid of it. It'll cut it off. Another thing that goes is what? What other systems are non-important that patients who have extreme malnutrition suffer from? Okay. And look, like I said, I'm here to test your critical thinking about this subject. Yes. So, also, guess what? Sadly, your immune system gets cut off. And I know it's counterintuitive because you're like, oh, well, you need it to stay healthy. But when it comes to survival, it's like, I can't focus on you being healthy in the future. I got to keep you alive right now. So the immune system has to go. All of those immune cells, you don't have the energy to keep them alive. So they go. Another thing that we know about patients with anorexia, how do they feel often? What do they say? Are they often very hot? Or are they often very cold? Yes, it takes a lot of calories to keep your body warm. So thermal regulation, cut off. Cut the heat, okay? Because the patient doesn't have the calories to keep itself warm, right? Oh. So, yes, people who are malnourished tend to be very cold. tend to be very, very cold. That lanugo, that is that fine body hair that tries to help insulate the patient, not gonna work. Patient's gonna be very cold. So another thing is too, your skeletal system goes. Why? Because it takes energy, it takes calories to help fortify the bones constantly, to help build new bone cells, right? And so these patients with anorexia nervosa are at an extreme risk of what? Of osteoporosis. Osteoporosis. And so now you know why, because all goes back to the amenorrhea. Amenorrhea. If the patient is having amenorrhea, they are in survival mode. So everything else gets shut off. Everything else gets shut off. Okay, let's go to, I guess I just want to end it. I just want to end it. The treatment is there. I want to go down to number of the clinical priorities. Go down to number 3, because this is often missed. Refeeding syndrome. Refeeding syndrome. This is so critical because if a nurse or a doctor feels like anorexia nervosa, they may think that the idea is to just treat it with food. Then it may be just the solution to just treat it with food. And when you feed a person who is malnourished too quickly, which is what happens with refeeding syndrome, then you put them at risk for complications that are life threatening, seizures, right? Coma, death. And it's just because you have such an influx of those electrolytes from the food into the cells that it puts the body in shock. So refeeding syndrome is when nutrition is started too quickly. Please pay attention to that. And then number 4 is really interesting too. If you read about it, maybe you might think, well, why did I write that in there? It says anorexic clients with distorted thoughts about their body image do not respond well to pharmacotherapy. Now, why would that be? Why? Why would a patient with anorexia nervosa not really be able to respond well with pills, with oral antidepressants? What's up with that? Well, I mean, why would that be? And if you use your critical thinking, you absolutely know why. Why? Especially from what we all studied here. Number 1, if they're not eating food, do you think they'll take medications? Like, no, they're not going to take medications orally either. It'll be just a struggle, as much as a struggle to get food down and to get medications too, right? Also, what is the condition of their body? Think about it. Are they in a position where their liver and their kidneys can metabolize new things? Do they have a bandwidth for that? In meetings, if you're given a big task or your boss wants you to do something big, you can say, like, I don't really have the bandwidth for it. Like, I don't really have the space to do that, to do anything extra. The body is like that. It's like, I don't really have the bandwidth to process this antidepressant. I'm really just trying to get by with nothing. Don't ask me to do anything else. And so that's what happens with patients with anorexia nervosa. Their bodies just don't respond to medications because they cannot. So we have to understand that the treatment for this is a very important point. I'm going to close with this. You cannot fix anorexia nervosa with food. Okay? Cannot fix anorexia nervosa with food. It is literally a disease that is fixed with compassion. Yes, compassion. You have to see these patients as having a mental illness. They need structure. They need reassurance. They need smart nutrition. Smart nutrition. All right. That was our review on anorexia nervosa. Such big saves lives. And I'm confident that now you are able to answer any question that NCLEX presents you on anorexia nervosa because you understand the ins and outs of it. And that's the benefit of coming to class. Winning Wednesday was brought to you by NCLEX V2. What it do? You need to get into this course for structure, for accountability, and for nothing else but community. You don't have to study alone. You do have to take NCLEX alone, but you don't have to study alone. So I hope that you will join us as we make our way through my teaching course. And again, it's a pleasure with you. I hope you all have a good evening. I love you so much. This week has been going by really great. We had an awesome Monday session and then another great Wednesday session. Our next topic will be appendicitis. We are still in the A's of quick facts. We got a lot to do, but it's going to be fun getting ready to go back to school here soon. It's coming up. Summer's almost over, so we better enjoy it while we can. I will see you guys on the next class. God willing, it's going to be great again. All right, everyone, get back in the V2, but you did your study session for today. So I'll see you later. As always, you know I believe it. You can, you will, and you must pass NCLEX. See you later. Bye-bye.